All right, we're looking at elbow patterns. Here we are going to look at lateral elbow pain. And you'll note that there are three main conditions here. Of course, we've trimmed that down. There are a number of conditions that could be possible hypotheses, but here we put lateral epicondylalgia, supinator syndrome, and possibly cervical radiculopathy. So we're talking about lateral epicondylalgia. You'll see in the prevalence that we've talked a little bit about the ages of 35 to 54 years old being the most common ages. And in this case, we're thinking that the tissues are becoming less resilient to stresses, and they're typically high levels of repetitive stress in this age group. These are typically full-time workers and people who are smokers, people who do manual labor, or people who play tennis are at high risk for this problem. When you watch the patient, you'll note they complain of lateral elbow pain that typically is worsened with gripping type movements. And in the physical exam, you'll note that some of the key findings: pain with forceful gripping and pain with palpation. You'll see that here. We're using a pressure algometer. Not only are you assessing for pain with palpation, but also for signs of central sensitization, pain with contraction of the wrist extensors, stretch to wrist extensors reproducing the patient's symptoms, and a number of special tests. In terms of associated impairments, we have added scapular muscle issues, cervical spine mobility deficits, thoracic spine mobility deficits, and upper quarter muscle length like the pecs and lats being potentially tight, and contributing to a body system, a movement system that is non-optimal for repetitive function. When it comes to the interventions, from a manual therapy standpoint, you can see you can manage some of the soft tissue mobility issues. You can also use a localized treatment, mobilization with movement, for lateral epicondylitis, the gripping maneuver. And as the patient moves into a more chronic tendinopathy type condition, then eccentric wrist training can be used. Submaximal isometrics might be the more ideal manual therapy management in the more acute or reactive stage of the condition. In managing associated impairments, we may want to improve their thoracic mobility, stretch their pecs. If their wrist flexors are very stiff, over-dominant, then we may want to do some type of soft tissue mobilization and stretching to this tissue. And if there are cervical mobility deficits present, then managing those are important as well. Your therapeutic exercises should fall under the categories of improving the soft tissue, nourishing that tissue back to health, managing some of the associated impairments, thoracic mobility and trunk muscle stretching, and giving them some type of education as well as eccentric exercises. In managing their associated impairments, scapular muscle strengthening has been shown in case studies and case series to help with lateral epicondylalgia. And in functional movement training, we may want to teach them to utilize or disperse stress over two hands, training the non-dominant hand, and using tools with optimal grip size, minimizing the overuse of hands with using the hand tools, and perhaps trying to utilize some power tools to help. There is also some lifting education to reduce wrist extensor stress. There you have it. That's the lateral epicondylalgia pattern.